Welcome to the Deep Dive. Today, we're jumping straight into the world of pharmacology.
Yeah, it's a really fascinating area.
Definitely. We're looking at an introduction to pharmacology document, and the plan is, well, to pull out the really key ideas about how medicines work and, the different types, but without getting too bogged down in technical jargon.
Right. Think of it like understanding what happens backstage when a drug enters your system, the how and why of it all.
Okay, so let's start right there. Pharmacology. What exactly is it?
So pharmacology at its core is the science of drugs. It's about understanding what they are and how they affect living systems like our bodies.
Simple enough. But what counts as a drug in this context? Is it just prescription meds?
Good question. The World Health Organization, the WHO, they define a drug pretty broadly. It's basically any substance used to modify physiological systems or pathological states for the recipient's benefit.
Modify physiological systems.
Yeah.
Okay, give me an example.
Sure. Think about paracetamol, for pain relief. That's modifying a pathological state, the pain. Or insulin for diabetes, that's modifying a physiological system to help control blood sugar. Both fit that definition.
Got it. So substances that change how our bodies function, ideally for the better. Now, you mentioned prescriptions, but also paracetamol. What's the difference between the drugs you buy off the shelf and the ones needing a doctor's note?
Yeah. That's the difference between over-the-counter OTC drugs and prescription drugs.
OTC, right.
Exactly. OTC drugs like, say, antacids or paracetamol, they're generally considered safe enough for you to use following the label directions without direct medical oversight.
Okay.
Prescription drugs, though things like antibiotics or strong painkillers or maybe antipsychotics, they require authorization from a healthcare professional, a prescription.
Why the difference? Is it just potency?
It's often about potency, yeah, but also potential side effects, the condition being treated. It ensures they're used correctly and safely for the specific person and situation. It's that layer of expert guidance.
Right, that makes sense. Now, the document mentions pharmacokinetics. It sounds a bit technical.
It sounds more complex than the basic idea, really. Pharmacokinetics is essentially about the journey a drug takes through your body. It's what your body does to the drug.
The body acting on the drug.
Precisely. We often use the acronym ADME to remember the stages.
ADME.
Yep. A for absorption, how the drug gets into your bloodstream. D for distribution, where it goes, how it travels to different tissues. M for metabolism, how the body breaks it down, often in the liver.
The liver does a lot of work there, doesn't it?
The major player, yeah. And finally, E for excretion, how the body gets rid of it, usually through the kidneys in urine or sometimes in feces.
Okay, ADME. Absorption, distribution, metabolism, excretion. The drug's life cycle in the body, sort of.
You got it. That's pharmacokinetics.
So then what's pharmacodynamics? Is that the other side of the coin?
Exactly the flip side. Pharmacodynamics is all about what the drug does to your body.
Ah.
This covers its mechanism of action, like how does it actually work? Often it involves binding to specific sites on cells, like receptors, to cause an effect.
And that effect is what we want, ideally.
Right, that's the therapeutic effect, lowering blood pressure, killing bacteria, relieving pain, whatever the goal is. But pharmacodynamics also covers the unwanted effects.
Side effects.
Exactly, those adverse effects, like maybe feeling nauseous or getting a rash or more serious allergic reactions. That's all part of what the drug does to the body.
So kinetics is the body handling the drug, ADME. Dynamics is the drug changing the body. Effects, good and bad. Got it. Now, the document talks about essential medicines and also orphan drugs. What are those about?
These categories tell us a bit about healthcare priorities. Essential medicines, according to the WHO, are the drugs that satisfy the most critical health needs of a population.
The really crucial ones.
Yeah. They need to be effective, safe, and importantly, affordable and consistently available. Think of drugs for major public health issues like anti-tubercular drugs, isoniazid is an example, or even basic iron supplements for anemia.
Things needed by a lot of people, so orphan drugs must be different.
They are. Orphan drugs are developed specifically to treat rare diseases or conditions. Things like certain genetic disorders that affect maybe only a small number of people worldwide.
Why orphan?
Well, because the market is so small, developing these drugs isn't always commercially attractive for pharmaceutical companies. So governments often provide incentives. The challenge is they can be very expensive because of that limited market.
Do you give an example?
Sure. Fomepizole. It's an antidote for methanol or ethylene glycol poisoning, like antifreeze poisoning. Absolutely critical if you need it, but thankfully not needed very often. That's a classic orphan drug scenario.
Interesting distinction. It shows how pharmacology tries to meet different kinds of needs. The document also just briefly notes some related fields: pharmacy, toxicology.
Right, it helps to see the bigger picture. Pharmacy is more about the practical side, preparing, compounding, dispensing medications safely. Therapeutics is broader, looking at the overall treatment of disease, which includes drugs, but also other approaches.
And toxicology. Sounds like poisons.
It is. Toxicology studies the harmful effects of chemicals, drugs included, if the dose is wrong or there's an adverse reaction, and also deals with poisons and antidotes. And then there's clinical pharmacology, which is super important. That's where drugs are studied in humans in clinical trials to see if they work and are safe before they get approved.
So it's all interconnected, a whole system to get safe, effective treatments. Okay, wrapping this up then, what are the main things to take away from this dive into pharmacology?
I think the key is just appreciating that whole journey. A drug takes ADME and the effects it has, the dynamics. It's this complex interaction. And also understanding that there are different types of drugs designed to meet very different needs, from those essential meds for global health to specific orphan drugs for rare conditions.
Yeah, it's pretty amazing when you stop and think about it. Consider something as simple as, say, a headache pill you might take. That little thing goes on this whole intricate journey, getting absorbed, traveling through you, being processed by your liver, finding its target to ease the pain, and then eventually leaving your system. It really highlights the complexity happening inside us all the time. Makes you wonder, what other everyday things, maybe even foods or supplements, have these complex interactions going on that we don't even think about? Something to chew on until next time.